Minister Maria.Caulfield.
Thank you, Madam Deputy Speaker. Can I start by congratulating my honourable friend, the member for Stafford, for such a courageous speech in describing the birth of her daughter and the terrifying experience that she had. It's great to hear that she did get great support from her NHS team, but also concerning about the negative experiences that she had. And I know from my experiences as the Minister for Maternity Services, that's not an isolated experience. Many will have similar experiences to those that she described. She's a tireless advocate for women who have suffered trauma as a result of their birth, and I just want to pay tribute to the work that she has done and will continue to do, I'm sure, in this space. I also want to congratulate members from across the House who've also shared their personal experience and that of their constituents. My honourable friend from Truro and Falmouth, who does so much on the area of baby loss, and I'm sure will be speaking in the debate following this. The honourable member for North Shropshire, who talked about her experience around C-sections, and just to reassure, we're trying to move away from those terms of normal and natural birth to a safe birth, by whatever means that takes, whether that's a natural birth or whether that is indeed a C-section. The Honourable Member for Canterbury, who I know I've been working with on the East Kent enquiry and the recommendations, and have met with many of her constituents in Canterbury who also shared their traumatic experiences about the care that they received. Also to the Honourable Member for Murray and for sharing his experience as a partner, but also just to point out that he reflects that many of these issues are in all 4 devolved nations across the United Kingdom, where similar experiences are had. And I can only respond as the Honourable Member, as the Minister for Services in England, but obviously work closely with devolved colleagues to try and ensure a consistent service across the country. So I've listened very carefully to contributions and want to pay tribute to everyone for their courage in sharing their stories. Before this debate, I was pleased to meet with the Honourable Member for Stafford to talk about the issues that she was going to raise and to share with her the many pieces of work the government is already starting, which were shared by women across the Call for Evidence in the Women's Health Strategy, and by meeting many women across the country when I have gone to meet them to discuss their maternity services. And there is clearly much more that we need to do in this space, but I will also share some of the progress that we are making too. And I salute the work of the newly established all-party parliamentary group on birth trauma, chaired by the Honourable Member for Stafford, which is showcasing an issue that very few people like to talk about. And she discussed about breaking the taboo, because even women who've been through the trauma are often very reluctant. It's a difficult subject to talk about, but it's an issue that's affecting thousands of women. And I think we saw by the response in the gallery how important it is that we do break that taboo and talk about the issues, both to prevent birth trauma, but also to manage the consequences of it when it does happen. And so I'd also like to commend the work of the charities such as Birth Trauma UK and many of the campaigners who are here today, because it is important that we do highlight this as an issue, because many women going through pregnancy do not realise that some of the choices that are available to try and prevent this in the first place. Madam Deputy Speaker, birth trauma and injury takes its toll on women both physically and mentally, and greater awareness from the public and healthcare professionals as well as the public is crucial in preventing birth trauma and mitigating its impact on women's lives. And providing compassionate care, as we heard a number of examples today, is essential both in reducing injury or preventing it in the first place, and helping women and their families cope with the impact of it when it happens. I will give way.
I thank the Right Honourable Lady for giving way, and I'm sorry I wasn't able to be in for the substantial speeches, but I would like to just ask her if she would join me in commending health practitioners like Stephanie Milne, who runs the Physio Village in my Livingston constituency, who does the Mummy MOT, and she talks a lot about birth trauma and how her work supports women who've been through birth trauma. Does she agree with me, though, that the NHS can do more to support women postnatally with those kinds of healthcare support?
Absolutely paid tribute, and we've heard some really great examples of work that's happening around the country, but I think the point has been made also that that's not consistently available to everyone. And it's those examples that show that why compassionate care is a key part of the work that we're taking forward, and particularly in relation to Bill Kirkup's report into maternity and neonatal services in East Kent, which was published last year. And Dr. Kirkup rightly emphasises the need for compassionate care and a change in culture, as well as a change in practice for women throughout their pregnancy, labour and postnatal period. Compassion, kindness and understanding all require women and their families to be treated as individuals and to be heard. And it is something that we did hear strongly in our call for evidence, where we had over 100,000 responses to the Women's Health Strategy. And it is why birth trauma is mentioned in the strategy, and I will come on to talk about that further. But as part of this, we have to recognise that PTSD, psychological trauma or depression that a mother may experience have to be also supported, and that just delivering a safe birth is not enough. And with my other hat on as the Mental Health Minister, it's why in the suicide prevention strategy, new mums are a high-risk group. And it's a shocking statistic that the leading cause of death in new mums is actually suicide. But it's a very vulnerable time in a woman's life, very often isolated from work colleagues if they're on maternity leave. Very often, if they're a first-time mum, will not have the support and network of other mums to support them. And you hear on social media, all over the place, what a wonderful time it should be in a mother's life. They should be blooming with a new child. And actually, the reality can be very different. We've heard that from people today, whether it is issues around breastfeeding, not sleeping, just feeling isolated. And on top of that, if you've suffered from birth trauma, the difficulties that can bring, not being able to drive, not being in pain, the whole raft of issues. So as well as the work we're doing in maternity, the work we're doing in mental health and focusing new mums as a high-risk priority group will try and drive forward the changes to support women better. And I'm pleased to be able to give the opportunity today to update the House on the wider progress we're making to improve outcomes in pregnancy, because I fully understand the importance of preventing perineal trauma during childbirth. And we will have to be honest that we can't always prevent it. I'm not a midwife, but there are risk factors such as a larger baby or a smaller cervix or a long birth that means that sometimes trauma and injury will happen. But there is no doubt more that we need to do to reduce it from happening in the first place, but if it does happen, to manage it in a much better way. That's why I'm really pleased that this week NHS England have published a national service specification for perinatal pelvic health services, which aims to be rolled out across England by March next year to end that postcode lottery of services that exist. This states that these services will work with maternity units across England to implement the Obstetric Anal Sphincter Injuries Care Bundle, known as OAC, developed both by the Royal College of Obs and Gynae, but also the Royal College of Midwives. And as my honourable friend from Stafford has said and has called for, this is an early success for the APPG in getting this rolled out across England. And I'm confident this new guidance, which will be implemented across maternity units, will reduce the rates of anal sphincter injuries resulting from labour and vaginal births, but also help manage them in a much better way when they happen. The introduction of these services will broaden the core service offer of pelvic health beyond the existing NICE and RCOG guidelines or care for obstetric anal sphincter injuries. The services will make sure that all pregnant women get the advice and support they need to prevent and identify pelvic health problems. And for those who do have problems, that they are offered conservative treatment options before surgery is considered in line with NICE guidelines. Now, Madam Deputy Speaker, we all know the crucial role that midwives play in recognising women who are suffering from perinatal mental illness. And this includes taking a trauma-informed approach to care. To support this, NHS England are refreshing their core competency framework for perinatal mental health. And I know the Shadow Minister touched on this earlier. And I just want to reassure her that by early part of next year, every integrated care system in England, and I can't comment what's happening in Labour-run Wales, but in England will have a fully working maternal mental health service to support mothers experiencing moderate, severe or complex mental health difficulties. It is true that the number of women accessing perinatal mental health services has risen almost 50% over 2 years, but that's actually good news because we want women to come forward. Our challenge as a government in England is to be able to meet that demand. For too long, women have suffered for silence and been isolated, but when they do come forward, we need the services there to support them. This demonstrates that mental health services are more important than ever before. A number of colleagues have identified the issue around inequalities in maternity care, and we do know that some women, particularly Asian, Black and working class women, are experiencing poorer mental health and poorer outcomes in maternity across the board. And that is why we continue to fight to introduce NHS equity and equality action plans across the country. So I'm proud of the progress we are making to develop resources, and particularly pay tribute to the Maternity Disparities Task Force, who are working with organisations to deliver this as quickly as possible. Now, there are a number of issues that were raised in the debate. I just want to touch on the one on women's health strategy and the issue of birth trauma being mentioned. We will be updating our Year 2 strategy fairly soon, and we'll be setting out our priorities, and I can let members know about that as soon as possible. So there's lots we could talk about, Madam Deputy Speaker, in this space. I just want to pay tribute once again to the Honourable Member for Stafford and all colleagues who shared their experience, and to reiterate this is a priority for the government, and we are seeing change, but more change needs to happen.